Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, the opioid epidemic in Pennsylvania, but first, the nationally watched Pennsylvania U.S. Senate and governor's election. We'll get to those after these words.
Welcome to the fast-paced and unrehearsed weekly discussion featuring the leaders who help shape your world. Join us as we address the issues that impact you each and every day. This is Pennsylvania Newsmakers. And now, here's your host, Terry Madonna.
Well, welcome back. Well, joining me are two journalists who are frequent guests on the program. John Micek, he's editor-in-chief of Pennsylvania Capital Star, and Brad Bumsted, he's the bureau chief of the caucus. All right, John Micek, I'm going to start with you. Every day, there are major stories now not just in Pennsylvania, but all over the country about our U.S. Senate election and our governor's race. The U.S. Senate election, imagine this, Dr. Oz and John Fetterman, two of the most unique you've been covering politics, unique personalities. Where does that election stand?
Well, Terry, right now the polling and the momentum seems to be going John Fetterman's way, as is the fundraising. We've seen some new numbers out just this morning before we hopped on the air by an outfit called Blueprint Polling, showing Fetterman with a pretty substantial lead. You know, he's been out there on social media. He's been trolling Dr. Oz mercilessly over questions about his residency. He comes from New Jersey. He might or might not live in Pennsylvania. He pulled in the Jersey Shore star Snooki to hit him on Twitter. He pulled in little Steven Van Zandt from the E Street Band just to do it the other day. I mean, this is an important race, Terry. This is one of 4 U.S. Senate races in the country that could determine the balance of power in the chamber. Putting aside sort of the comedic element of it, this is a very high-stakes race.
Yeah, I'll tell you, Brad, you've covered a lot of these. What personalities? I mean, we have Dr. Oz, the television star, the media star. Then we have John Fetterman with the build and his personality.
6'8", right.
Go ahead.
And I mean, you have a recovered or recovering heart patient and a heart surgeon in the same race, which I find interesting.
Yeah.
But it's the idea that Oz would be behind in this race never really occurred to me, but the text messages I get from his campaign uses that tactic to raise money, whether he is or not. I'm losing. You need to contribute today, you know, so I can defeat John Fetterman, this socialist, he calls him. Yeah, right? Yeah. So,
so that's right, the socialist.
Right. And Shapiro, Josh Shapiro in the governor's race had text messages out yesterday. Brad, if I could just get $5, just $5 from you.
Yeah.
Right, did you see that?
Yeah.
Yeah. So every dime is being, you know, pulled in, and they need it.
Yeah. I mean, basically, the Senate election, there's been 2 themes. Welcome back to New Jersey every time Dr. Oz leaves the state. And then with Oz, with Fetterman's health, come out of hiding. I mean, basically, they've been the major themes. Now, the issues are there, but they haven't been nearly as prominent as those 2 themes I just mentioned.
Yeah, I mean, it's summer, it's a little slow. Voters traditionally don't really plug in, as we know, until after Labor Day. So Fetterman has been trying to define Mehmet Oz, who's got the endorsement of former President Donald Trump. Oz has been trying to hit back at Fetterman, who, by the way, suffered a fairly serious stroke just before the primary, and then had a pacemaker implanted to deal with a heart condition. So it's frankly a little childish for Dr. Oz, somebody who ought to know better as a surgeon that it takes a little while to come back from these things. Fetterman is back out on the trail now. He returned last week. He did an interview with the Pittsburgh Post-Gazette, says he's feeling better. It's still taking him a little bit of time. So, you know, we'll see how long that, you know, that line of attack from the Oz campaign lasts.
I don't think any of us were surprised at the idea that Shapiro has pulled ahead in the race. However, the note I would throw out there is I never heard of this polling company, Blueprint, may be the greatest in the world. I don't know. But every time I hear a new polling company come in, I just look askance until I see the next poll to see how that goes. But nonetheless, it sounds right. We thought that was what was going to happen.
State Senator Doug Mastriano, a conservative, right-leaning, I'm being mild about this, versus Josh Shapiro, the current Attorney General. Brad, the fact of the matter is Josh Shapiro has wanted to run against Mastriano. He ran commercials during the primary. Democrats are doing this all over the place.
Yes, they are. Yeah, and it's a tactic that now people are saying if these numbers hold up, that may have paid off. I think it's far too early to say that. Just as Mastriano came out of the primary with a lead because of momentum and because Shapiro wasn't doing that much. Now Shapiro has been hitting him and it appears to be opening up a lead. But don't be surprised by October if it starts to tighten again.
Now, John, Mastriano, the fact of the matter is that Republicans, establishment Republicans, didn't want him to be the nominee and took steps to try to prevent that. But now, are they coming around now? I've been reading stories that I guess they're concerned that if he loses big time, I'm not saying he will, but should he, that could hurt the ticket down ballot.
Yeah, I mean, you have these sort of like never Doug Republicans, a handful of establishment types like Charlie Dent, former Congressman Jim Greenwood, and others who are saying that Mastriano, a white nationalist, a Christian nationalist, is too extreme to run statewide. Whether they represent the majority of the voice in the Pennsylvania Republican Party is another matter entirely. We've seen some other establishment Republicans starting to come around on Mastriano now. And making, of course, always that Hobson's choice that you make when you're an establishment figure. Do you want to see a Democrat elected, or do you want to see your guy elected? And that's the choice.
All right, we're going to run to a break. When we come back, we're going to talk about election reforms. We'll do that after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
All right, in 2019, we had the motor voter law passed in the state of Pennsylvania. It's been controversial since it was adopted. John Micek, there's been conversation since then about changing it, modifying it. Where does that all stand now?
At the moment, kind of nowhere. The Republicans in the House, all of whom were reelected, it should be noted under the auspices of Pennsylvania's mail-in balloting law passed in 2019, which they now don't like, sent Governor Tom Wolf a bill last year, 2021, that he vetoed. It had a bunch of fixes with voter ID, limiting the number of drop boxes, a bunch of refinements. House State Government Committee Chairman Seth Grove held a news conference last week, releasing a report where he detailed what he said were problems and inconsistencies across the last several election cycles, reiterated the case for an election fix. The problem here is, Terry, is the time is not on their side. Legislature comes back in the middle of September with literally weeks before the election.
And another big problem is that there are 3 lawsuits out there against mail-in voting that probably won't overturn mail-in voting, but if even one appears to do so or has a preliminary opinion about it, it could cast a cloud over mail-in voting. People might think, oh, well, I can't do this anymore and not vote that way. So it's Supreme Court of Pennsylvania, U.S. Supreme Court.
Right. But there's one common sense. I mean, why can't they begin to process the ballots before 7 a.m. on Election Day, Brad? That I don't understand. You could have Democratic and Republican observers there, to make sure that they're processed correctly. Why do we have to wait until 7 a.m. and then you have thousands of these mail-in ballots to count? And in some cases it takes, we vote on a Tuesday, the rest of the week to get them counted. That doesn't make any sense.
Well, if I were really cynical, I would suggest that the confusion that comes from a whole bunch of votes being uncounted at the end, that's where the allegations of fraud come up.
One of them, yeah.
If I were cynical, I'd say that. On the other hand, it makes sense to get as many out of the way, not just the election workers, but people want to know on Election Day who won.
Yeah, I mean, you can't wait until 5 days later to figure out who won an election, John.
Or sometimes even longer in
Yeah,
certain
good
contests.
point.
I mean, the county governments, these are the jurisdictions that are responsible for administering elections, have been pushing for an expansion, Terry, what's known as this pre-canvassing window. For at least 2 or 3 election cycles now. It's complete chaos for workers to sit there and they can open the ballots starting at 7 a.m. They can't process them until after the polls close. So you have the regular cast ballots at the voting machines plus tens of thousands, in some counties of mail-in ballots that remain to be counted. And Brad is quite correct. It lends itself to these cynical allegations and baseless allegations of voter fraud. And, in some ways that also goes to undermining public confidence in the process. So you would think at minimum they could get an agreement on this. I ran into Governor Tom Wolf earlier this week at an event in York. He says he's open to talks. He says he's open to conversations about expanding that pre-canvassing window, but would be opposed to anything that looks like voter suppression. So we're talking about limiting drop boxes or voter ID or that kind of thing.
Yeah, but to put a conclusion on this, it looks like no change, no way, no how, and it could be indefinitely.
It looks like a static line on this, except for whatever happens in the courts, always unpredictable.
Right. And should Doug Mastriano win the election, I think, and the Republican control the legislature, mail-in balloting is gone, would you say?
He wants it gone, so I guess we'll see what happens.
Well, he would decide elections.
Yeah.
Yes, by himself, unilaterally.
All right, thanks for the update. All right, coming up, the opioid epidemic in Pennsylvania. We'll get to that after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Cross-State Credit Union Association. Credit unions, where people are worth more than money. To find a credit union that is right for you, go to ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
Welcome back. Well, my special guest for the next couple of sections is Dr. James Latronica. He's with the Pennsylvania Medical Society, the Early Career Physician Section Chair. All right, Doctor, the opioid epidemic, and I think that word epidemic is appropriate in the state of Pennsylvania.
Yeah, thank you, Dr. Madonna, for having me. I think it's important to talk about not just the past, but the present and how the epidemic, specifically the overdose epidemic, has unfolded. And over the past 5 to 7 years, it's really been driven by the increase of fentanyl in the banned drug supply.
Yeah. Now, is this more among demographically? Is this more young folks, or has it expanded to, middle age and even seniors?
Yeah, it really depends. Certainly, people who use drugs often skew younger, but that's not exclusively the case. And we see overdose deaths rising across the board in terms of age, in terms of ethnicity. So it really does affect everyone in those folks' communities.
Yeah. Well, let's talk about treatments for it. And basically what I want to talk to you about are, things that reduce the risk or harm to yourself. And one of them is called harm reduction services. Until we had this conversation, I've never heard that before. Harm reduction services. What is it?
So the philosophy behind harm reduction is meeting people where they're at. Meaning, I have a lot of people who come to my clinic at various points in their lives. They may not be ready, willing, or able to stop using whatever substance it is they're using at a given time. Of course, that's always the goal, but in the interim, we have this term called harm reduction. And not just for people who use drugs, but I think of harm reduction in terms of cholesterol medicine that prevents heart attacks, or seat belts in cars that prevent fatal motor vehicle accidents. They're things that can prevent negative or disastrous outcomes. And in that regard, in terms of substance use, we have things like syringe exchange, so people don't contract HIV or hepatitis C. We have naloxone distribution. We have referral to services for people who don't have housing.
Yeah, one of them, when I looked this up after you sent this topic, a nicotine patch instead of smoking, is that an example of what of reduction services, a harm, to reduce the harm?
Absolutely, I think that's a great analogy.
Now, how widespread is this service?
Yeah, so it depends on where you are. So the specific type of harm reduction syringe service programs that we're talking about today, they're already explicitly legal in 31 states and Washington, D.C. In Pennsylvania, unfortunately, they're not currently legal outside of specific municipalities, and really they operate in a legal gray zone. So services here aren't as widespread as they might be.
Well, we're going to run to a break. I want to talk about syringe service programs, and do they work, and what kind of money do they actually save? And we'll do that following these words.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine.
My special guest is Dr. James Latronica. He's with the Pennsylvania Medical Society. We're talking about the opioid epidemic in Pennsylvania. Well, doctor, let's talk about syringe service programs. What are they?
Syringe service programs are places that people can go in order to obtain a variety of services. So as the name suggests, it's where people can get syringes free from contamination. They can also get things like naloxone to prevent overdoses. They can get referral to social services or substance use treatment. And the thing is, they work. They really work. The evidence is overwhelming, both here and abroad.
Now, is it becoming more, is that service becoming more widespread among physicians?
Those who administer syringe service programs tend not to be physicians. They tend to be activists and other community members. Okay. Acceptance of those, I think, certainly has risen over the past decades. And I'll admit, physicians have not always been the best allies when it comes to people who use drugs. So I've been happy to see an increased level of support among my colleagues.
So the bigger point is, A, they work. How about in terms of, this question always comes up about the money aspect of this. It seems to me they're likely to save money as well as to save lives. Am I right or wrong about that?
No, you're definitely right. And I appreciate you leading with the lives and health part, because that's most important. But as you know, Dr. Madonna, when we talk about public health initiatives, we weigh costs and benefit, and is the harm that's reduced, whatever it is, worth the cost. In this case, we have an intervention that saves money. So we save lives and save money, which is very unique among public health initiatives.
Now, does the Medical Society have a policy on that service?
They do. They support access for syringe service programs. We passed a resolution at our House of Delegates, and it was overwhelmingly supported.
Yeah, I want to go back to harm reduction services, and as I indicated before, I've not heard of this before, and it's very, very unique. And if I heard you correctly, the services are not provided in every single municipality, every single county. So would it take legislation in order to accomplish that?
Correct. Yeah, because of various statutes and regulations, they are not expressly legal in the Commonwealth at this time. There is legislation currently, Senate Bill 926, which would allow for the amendment of the Controlled Substances Device and Cosmetics Act. Similar legislation, which would allow for drug supply testing in the form of fentanyl test strips, was passed unanimously in the House. So we're eagerly waiting to see how those bills do.
Yeah, absolutely. Hey, in a very general way, the folks who physicians have to deal with in terms of the opioid epidemic, are they mostly general practitioners, or do people go into, well, you may end up in an emergency room, obviously, but is this something that all physicians deal with, or does it tend to be more, more among general practitioners?
It tends to be specialists. So I'm a little bit unique in that I'm board certified in family medicine, but I provide substance use and behavioral health treatment full time. We would love to see more general practitioners providing things like buprenorphine or naltrexone and treatment for other substance use disorders. It hasn't caught on, and the reasons for that are manifold. We don't have time for all of that, but I would love to see it incorporated, especially younger family medicine docs saying, this is part of what we do. This is whole person care.
Yeah. Hey, before I let you go, are there any big changes in terms of the diseases or the health care problems that people have? This is a question that I wanted to ask. I usually ask my family doctor, but I'll ask you.
You mean in terms of adverse reactions?
Yeah, just overall healthcare.
Yeah. So, in terms of overdoses and substance use, increases in things like hepatitis C, hepatitis B, and HIV are certainly what we worry about most. But the pattern is, for when I was in medical school, for example, we didn't have a cure for hepatitis C, and during medical school we did. So, that was a huge change that kind of came without a lot of fanfare. So that was a big, in my field, a large change.
All right. One of the things that we talk about on this program, and you hear repeatedly with a whole bunch of professions, is the word shortage. Is there a shortage of physicians in the state of Pennsylvania?
There's a shortage of physicians everywhere, and especially when it comes to behavioral health and substance use treatment. I will note that a program recently restarted by the Department of Health, which provides loan repayment for those who are practicing in areas where the overdose rates are high, and which if you're doing substance use treatment. So it pairs nicely with some federal programs.
Yeah, that has to put enormous pressure on the healthcare community with the shortage, and I presume that has to do with assistants, nurses, and other people who serve patients.
Yeah, we have doctors prescribe medications and we manage patients, but certainly treating people with substance use disorders takes, like you say, nursing, medical assistants, social workers, all those things.
Well, look, I want to thank you for coming on. This was a great update, and I hope to see you in the future. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, you stay well.